Good morning, everyone. Today, we'll discuss ACE inhibitor medications, which are very important for the exam. A client on Lisinopril, so drugs ending in pril belong to the ACE inhibitor category, has been taking the medication for 5 days. Which assessment finding requires the nurse's immediate intervention? This means we need to select the option suggesting the patient could be in immediate danger. So ACE inhibitors, any drug that ends in pril, is related to the ACE inhibitor class. For example, we have Captopril, Enalapril, Ramipril, Benazepril, and Lisinopril. All of these drugs are classified as ACE inhibitors, and these drugs are given to treat hypertension and to treat heart failure. So here we must select the most serious side effect of that drug, a dry, persistent cough that worsens at night. This means a patient can develop a dry cough if they are taking lisinopril. Why? Because these are the lungs and this is the bronchi. And I'm drawing the blood vessels here, which are the capillaries. In our body, there's an inflammatory mediator called bradykinin. That bradykinin remains inside the blood. So this is bradykinin. This bradykinin is the inflammatory agent. Our lungs secrete the ACE, which stands for angiotensin converting enzyme. That angiotensin converting enzyme breaks down this bradykinin. It means it destroys that bradykinin. It removes the extra bradykinin, so there won't be an excess of it. Angiotensin converting enzyme, or ACE, always breaks down excess bradykinin, so it won't let bradykinin accumulate in the blood. So that's the normal condition. But if we give an ACE inhibitor drug like Captopril, Ramipril, Enalapril, Lisinopril, or Benazepril, if we give any of these to the patient, then these drugs will block that ACE action, because, as the name suggests, they are ACE inhibitors. This means they will block the production of ACE by the lungs. If there's no ACE, if there's no angiotensin converting enzyme, it means there's nothing to break down the bradykinin. Bradykinin. Now, this bradykinin will remain inside the blood, so there will be excessive bradykinin collection in the blood. So that bradykinin, this is not destroyed by the ACE inhibitor because the ACE inhibitor is this is not destroyed by the ACE because ACE is not being produced. Given the patient an angiotensin converting enzyme inhibitor drug, so there will be an excess of bradykinin here, bradykinin here, bradykinin here, bradykinin. Now, this bradykinin will start to enter into the lungs. That bradykinin will come into the lungs. That bradykinin will come into the lungs, and after coming into the lungs, this bradykinin will irritate. This bradykinin will irritate the cough receptors. There are some receptors that are responsible for coughing, so this bradykinin will irritate these cough receptors, and as these cough receptors are irritated, then there will be dry cough production. So whenever we are giving the ACE inhibitor to the patient, there will be a dry cough. But this is not lethal. This is not fatal. But this does not put the patient in an immediate life-threatening condition. So we can say that if the patient is taking lisinopril or any kind of ACE inhibitor drug, that there will be a dry cough because bradykinin is not destroyed by ACE, so more of the bradykinin will collect in the lungs. That'll irritate the cough receptors. So there will be a dry cough. So it means there will be a dry cough. But this is not dangerous for the patient. It leads to discomfort. So it will lead to discomfort only. But we have to select the situation that will put the patient's condition in immediate danger. Immediate intervention means we have to select the most serious condition. So here, this is the wrong answer. This is wrong. Next is the blood pressure of 104/68 millimeters of mercury after the first dose. As we know, ACE inhibitors are blood pressure lowering drugs, meaning they will reduce blood pressure, so this is the expected effect of that drug. 104 means the blood pressure has come within the normal range, and 68 diastolic. It means that's slightly lower than the normal range, but this is expected after the first dose. It means this is also expected. So here, this is also wrong. Next is swelling of the lips and difficulty in swallowing. If the patient has the swelling over the lips and difficulty in swallowing, so we have to know that if we give the lisinopril to the patient, then it will stop the ACE production. If there is no ACE production, it means there will be too much of the bradykinin. If there is too much of bradykinin, then we know that bradykinin is the inflammatory mediator. It means it will lead to the inflammation. I am currently making this, which is the diagram that shows the structure of blood vessels in the body. So this is the blood vessel, and it contains the too much of the bradykinin. Because we have given the ACE inhibitor, so there is the excessive production of the bradykinin. Now, this bradykinin will reach around the blood capillaries that are surrounding our lips, our throat, our tongues. So here, these are the blood capillaries in the normal situation. But if there is too much of the bradykinin, then these capillaries pore will be dilated. So there will be too much of then the pore size will increase. It means capillary permeability will be increased due to the capillary dilation due to the effect of bradykinin because it is the inflammatory agent. Now the fluid will go outside. It means the fluid will shift outside from the blood capillary to the surrounding tissue, around the lips, around the tongue, around the throat. So if the fluid is collecting inside the tissue and outside to the blood capillaries, it means there will be fluid outside to the capillaries, but among the tissues. This will be called as edema. So we can call this edema. But this edema has occurred due to the blood vessels dilation. And blood vessels, we can call the blood vessels angio. So this condition is known as angioedema. So edema that occurred due to the dilation of the blood capillaries. So we call this angioedema. So if this has occurred, then there will be swelling around the lips, around the tongue, and swelling around the throat. As we know that if this is the windpipe and this is the windpipe or trachea, these are the bronchi, these are the lungs, and here is the throat. If there is swelling around the throat, it means we can say that if the swelling increases, then the airway here will be obstructed. So we can say that if there's swelling around the lips and the tongue is swollen and there is difficulty in swallowing, it means we can guess that angioedema has started to occur. So at any time, it can lead to airway obstruction. So this is a medical emergency because we always have to think ABC, airway, breathing, and circulation. Whenever we find that there's an airway obstruction or an airway problem, we have to put this in the priority conditions. So this is life-threatening, and so we can say that this is an emergency condition. So we have to select the life-threatening condition. So here, this option C will be correct. Next is the potassium level of 5.2 milliequivalents per liter. So the normal potassium level in the blood is 3.5 to 5 milliequivalents per liter. It means here is 5.2, but the normal is 5 milliequivalents. It means that there's a mild hyperkalemia. So hyperkalemia is not good for the patient because it can lead to cardiac dysrhythmia, then heart block, and then cardiac arrest. But between these two conditions, we have to apply the ABCs, airway, breathing, and circulation. So this option, option C, suggests that there is an airway problem. And this, we can say, is an electrolyte imbalance. But this is also serious. But here, the more serious one is option C, because it can lead to an airway obstruction at any time. And you can remember this by the mnemonics as well. Whenever you see an ACE inhibitor, AC, ACE inhibitor. So A is related to Angioedema, as we discussed earlier, angioedema, C is related to cough, and E is related to elevated potassium, so elevated K. So elevated potassium means whenever you see an ACE, whenever you see any drug ending in pril, you can see the side effect will be related to its name, ACE. So A is related to angioedema. It means it can lead to an airway obstruction. And C is related to the cough, and E is related to the elevated potassium. These all will be the side effects of the ACE inhibitor. A client taking Lisinopril. Again, Pril, it means this is also an angiotensin-converting inhibitor drug. Develops swelling of the face and the tongue. What is the nurse's first action? So we've discussed this earlier. So whenever you see that, if any drug contains Pril, it means it is an ACE inhibitor. And here, as you have seen, there is swelling of the face and the tongue. If there is swelling of the face and tongue, it means you can see that the side effects of ACE drugs are like this. A is related to angioedema, C is cough, and E is elevated potassium. So angioedema means edema due to increased capillary permeability. So that can lead to airway obstruction. So whenever you see that, you have to immediately withhold the medication and inform the doctor. So what is the nurse's first action? Administer the next dose of lisinopril. No, we will not administer the next dose of lisinopril, because if we administer the next dose of lisinopril, then there will be a further increase in the angioedema. So as the angioedema increases, there will be more edema around the lips, tongue, and throat. That will lead to obstruction of the airway. Document the finding. Now, if this is not normal, so we will not just document this. First of all, we will stop and then inform the doctor. Maintain airway and notify the provider immediately. Yes. We will maintain the airway and notify the healthcare provider. Encourage oral fluids. Increasing oral fluids will not reduce the angioedema. A nurse is providing discharge teaching to a client who has been prescribed lisinopril. Again, lisinopril, it means an angiotensin-converting enzyme inhibitor drug. Which statement by the client indicates a need for further teaching? Whenever you see further teaching, it means you have to select the incorrect statement. I will rise slowly from a sitting position. This means the patient understands that he has to rise slowly from a sitting position. So all angiotensin-converting enzyme inhibitor drugs, meaning ACE inhibitor drugs, reduce blood pressure. So when the patient immediately sits up from lying down or immediately stands from a sitting position, then gravity will pull the blood downward toward the legs. This means less blood will reach the heart. So again, there's less blood for the heart to pump to the body. So there will be less blood available to pump to the body and less blood going to the brain. This means if the brain receives less blood, then there will be less cerebral perfusion. If cerebral perfusion, meaning perfusion in the brain, is reduced, then there will be dizziness, syncope, or fainting. Or the patient can fall at any time. So we have to tell the patient whenever they're taking any kind of blood pressure lowering drug. So they have to change position slowly, they have to sit up from a lying position slowly, and they have to stand from a sitting position slowly or gradually. So this is a correct statement, which means we have to, but the question is asking for the incorrect statement, so this is wrong. I should report the swelling of my lips and tongue immediately. This means that the swelling of the lips and tongue is related to angioedema, and that can lead to obstruction of the throat and the airway. This means the patient understands this correctly, so this is also a correct statement, and therefore it's the wrong answer here. I will use salt substitutes freely because they contain less sodium. Whenever a patient is taking an ACE inhibitor, it means the ACE inhibitor always works on the RAS system. What is the RAS system? The RAAS system stands for the renin-angiotensin-aldosterone system. We know that this is the liver, and it produces a protein called angiotensinogen. Angiotensinogen. This angiotensinogen enters the blood vessels and travels along with the blood to the kidneys. If the blood pressure is low, if the BP is low, meaning blood pressure is low, then the kidneys sense that the BP is low. Then the kidneys secrete renin, and as the kidneys secrete renin, then this angiotensinogen protein will be converted into angiotensin 1. Angiotensin 1. But this angiotensin 1 is in an inactive form because it cannot cause vasoconstriction and it cannot lead to the production of aldosterone, so it's inactive. As this blood reaches the lungs, so this blood will reach the lungs. Then the lungs will secrete the ACE enzyme, which means angiotensin converting enzyme. Now, this angiotensin 1 will be converted into angiotensin 2. By this ACE enzyme, by this angiotensin converting enzyme. Now, this angiotensin 2 is in its active form. This means it can now cause vasoconstriction, so the blood vessels will constrict, and as they constrict, it means systemic vascular resistance will increase. We've seen the formula for blood pressure. BP, or blood pressure, equals systemic vascular resistance times heart rate times cardiac output. If systemic vascular resistance increases, then the BP will increase. So we're talking about the normal condition here. Up to this point, we haven't given the ACE inhibitor to the patient. We'll discuss later how this RAS system responds after administering any kind of ACE inhibitor drug, but for now we're discussing the normal RAS system. This angiotensin 2, will now reach the kidney through the bloodstream. And there's a gland on top of the kidney called the adrenal gland. So this blood will arrive at the adrenal gland. Once it reaches here, this angiotensin 2 will stimulate the secretion of aldosterone. Now, this blood contains aldosterone, which is secreted by the adrenal gland. Now, this aldosterone will reach the kidney via the renal artery. And as you know, there are millions of nephrons within the kidney. So this is the nephron. On the DCT and collecting duct, that aldosterone will reach here at the DCT and collecting duct. And now it will increase the reabsorption of sodium into the blood capillaries. So here are the blood vessels, the blood capillaries. Now, as the aldosterone arrives here then the sodium will enter into the blood vessels. As the sodium enters the blood vessels, the potassium will exit the blood vessels into the nephron, to the collecting duct, and via the collecting duct, it will be excreted from the body. That is the normal situation. But after administering an angiotensin converting enzyme inhibitor, what will occur? If we administer an angiotensin converting inhibitor, it means there will be no production of ACE by the lungs. It means if there is no ACE enzyme, then angiotensin 1 will not be converted into angiotensin 2. So there will be no angiotensin 2. If there is no angiotensin 2, it means these blood vessels will not be constricted. It means the systemic vascular resistance will decrease, and if the systemic vascular resistance decreases, it means blood pressure will be reduced. So that is what we want in hypertension. And another thing is this, that if there is no angiotensin II, it means there will be no aldosterone secretion by the adrenal gland. If there is no aldosterone, it means there is no reabsorption of sodium. If sodium is not reabsorbed, it means sodium is not entering from this filtrate into the blood vessels. So the potassium will not exit. If the potassium does not exit, it means potassium will remain inside the blood vessels. If the potassium remains inside the blood vessels, it means there is potassium retention. So the potassium level will increase. So the chances of hyperkalemia are increased after administering an ACE inhibitor. So we have to avoid foods that are high in potassium, like bananas, spinach, oranges, avocados, potatoes, and coconut water. All of these high potassium diets should be avoided. If the patient is taking an angiotensin-converting enzyme inhibitor drug, that was the reason. And you should also avoid salt substitutes, because salt substitutes are salts that don't contain sodium, but they do contain potassium. But if the patient is taking an angiotensin-converting enzyme inhibitor drug, then it means there's a chance of potassium retention. If potassium is being retained in the blood, it means there's a chance of hyperkalemia. And hyperkalemia can lead to cardiac problems like cardiac dysrhythmia and heart block and cardiac arrest. So sometimes students can be confused by salt substitutes as they understand that salt substitutes contain sodium. But salt substitutes don't contain sodium, but they do contain potassium. So we should not give them in any condition where there's a chance of hyperkalemia. So I will use salt substitutes freely because they contain less sodium. No, well, yes, we can say they contain less sodium, but they contain more potassium. But we don't want this because we're giving lisinopril to the patient. So lisinopril is leading to the retention of sodium in the blood, so there are chances of hyperkalemia. So we will not give the salt substitute. I may experience dizziness when starting the medication. Sorry, because the question is asking for the incorrect one, further teaching. It means the incorrect statement will be the answer here. So this is the correct answer here. Next, I may experience dizziness when starting the medication. Whenever we start blood pressure lowering drugs, the patient will experience dizziness.
Before we move ahead, here's something you shouldn't miss. If your goal is to pass the NCLEX in just 1 week or 1 month, then the fastest and most effective way is to enroll in our complete online NCLEX review crash course. This course is a one-stop solution, a reliable shortcut, and a proven method with a solid 99% passing rate. More than 5,000 students have successfully passed the NCLEX by using this course. Here's exactly what you'll get. 100-hour mini crash course perfect for those who want to pass within a week. 300-hour comprehensive lectures covering 300 essential NCLEX topics that are commonly tested. 5,000 real NCLEX questions. Prepare with real exam questions and eliminate surprises. 15 full practice tests, including CAT simulations, simulate the real exam for a stress-free experience. Exclusive ebook plus 1-year access. Study whenever and wherever you want. Seats are filling up quickly. Enroll now to save 70%. Visit our website to enroll in our complete NCLEX review crash course. The link is in the description. Now, let's continue with the topic.
So this is a correct statement. So this will be here the wrong one. Question. The nurse reviews laboratory results for a client receiving Ramipril. Again, pril, it means it's an angiotensin-converting enzyme inhibitor drug. Which finding requires immediate intervention? So we have to find the condition that is more serious or more lethal to the patient. As we discussed in the previous question, and as you might remember, we know that whenever we prescribe or give an ACE inhibitor to a patient, there's always a possibility or a chance of developing hyperkalemia. So it's something we need to keep in mind whenever we're considering this type of medication, because Ramipril is an ACE inhibitor and ACE inhibitor will work on the renin-angiotensin-aldosterone system. It means that it will reduce the production of the hormone aldosterone, so there will be less of this hormone in your body overall. Aldosterone. It means less sodium reabsorption. It means less sodium will enter into the blood from the collecting duct to the blood vessels. So if less sodium is coming inside the blood vessels, then less potassium will go outside from blood vessels to the collecting duct of the nephron. It means there will be the retention of the potassium in the potassium due to the angiotensin converting enzyme inhibitor drugs. So which is the more serious lab value here? Potassium is a 5.9. Yes, this is the elevated because the normal potassium level is the 3.5 to 5 milliequivalents per liter. It means this is the severe hyperkalemia. So here, this will be the correct answer. Sodium is 135 to 138. It means this is within the normal range. The normal range is 135 to 45 milliequivalent. Hemoglobin 13.5, this is also in the normal range, and calcium is 9.2. The normal range of calcium is 8.5 to 10.5 milligram per deciliter. A nurse is assessing a client who has just received the first dose of Captopril, the drug ending with the pril. It means this is also the ACE inhibitor. Which assessment is the priority? Respiratory rate, blood pressure, bowel sounds, and visual acuity. So this is the blood pressure lowering drugs. So before starting this drug, we have to check the blood pressure. ACE inhibitors work on the RAS system, reducing aldosterone production. The client has been taking Lisinopril for hypertension. Lisinopril, again, is an angiotensin converting enzyme inhibitor for hypertension. Which assessment findings suggest that the medication is achieving its desired therapeutic effect? So we have to determine if we can say the medication is working properly. Lisinopril is given to reduce hypertension. Blood pressure decreased from 168 over 96 millimeters of mercury to 128 over 78 millimeters of mercury. This means the blood pressure has been lowered, so we can conclude that the medication is effective. The heart rate went up from 80 to 110. Lisinopril doesn't have any effect on the heart rate. Potassium rose from 4 to 5.8 milliequivalents. We know that Lisinopril is an AC inhibitor, and when we give an AC inhibitor to a patient, it increases potassium retention. But this is too large of an increase in potassium. This is a case of severe hyperkalemia. This is not the effect we're looking for. Mild hyperkalemia is a possibility, but it's gone from 4 milliequivalents all the way to 5.8 milliequivalents. This indicates toxicity. Or rather, we can say it's severe hyperkalemia. This is not the desired outcome. The respiratory rate increased from 16 to 28 breaths per minute. This isn't related to the ACE inhibitor. A client is undergoing Lisinopril therapy for hypertension. Lisinopril, again, is an ACE inhibitor drug used to lower blood pressure. Which medication order should the nurse question before administering it? So whenever you see a question about which order a nurse should question, it means a drug was prescribed incorrectly by the doctor. So the nurse should question that specific drug. The first option is acetaminophen. Now, with Lisinopril, you have to keep this in mind. Because of Lisinopril, potassium levels will increase, which can lead to hyperkalemia. So you need to find the drug that increases blood potassium levels. Acetaminophen, now that won't increase potassium levels. Furosemide, yes, you have to remember that the furosemide class of drugs, furosemide is a type of medication known as a loop diuretic, which means it helps your body get rid of extra fluid by acting specifically on a part of the kidney called the loop of Henle. So to put it simply, furosemide works by targeting the loop of Henle in the kidneys, which is an important area involved in the process of filtering and removing excess water and salt from your bloodstream. This is the nephron, and here's the loop of Henle, and furosemide acts on this part of the loop, specifically the ascending limb. And right here are the potassium and sodium channels. Furosemide blocks them, and if both channels are blocked, it means any sodium in the filtrate won't be reabsorbed into the blood and will be excreted from the body. The potassium channel is also blocked, so the potassium will be lost in the urine. This means there's no chance of hyperkalemia. So this is incorrect because we need to find the drug that increases potassium levels in the blood. Next is spironolactone. Spironolactone is also a diuretic, but it doesn't work on that specific part. Spironolactone works on the distal convoluted tubule and the collecting duct, so it blocks the principal cells. If it blocks the principal cells, if the principal cells are blocked here, it means these are the blood vessels or the capillaries. I'm talking about normal conditions right now. In the nephrons filtrate, there's sodium and potassium, but because of the principal cells, sodium enters the capillary. When sodium enters the capillary, potassium leaves the blood vessels, enters the DCT, and is then excreted in the urine. That's the normal process. Keep in mind that through these principal cells, if sodium goes in, potassium comes out. If sodium doesn't go in, then potassium won't leave the blood vessels for the nephron, and it won't be excreted from the body. So if we give spironolactone to a patient, it blocks this channel, this these principal cells. Now, if these principal cells in the DCT and collecting duct are blocked, it means sodium isn't being reabsorbed here. If sodium isn't reabsorbed, it's excreted from the body, and water follows the sodium out. That's exactly what we want from a diuretic. But if sodium isn't moving from the DCT and collecting duct into the blood vessels, then potassium won't be exchanged and move out. This means if potassium isn't leaving the blood vessels for the DCT and collecting duct, it stays in the bloodstream. If potassium isn't excreted, it builds up in the blood vessels, causing potassium levels to rise. So spironolactone leads to hyperkalemia and potassium retention. Therefore, we shouldn't give spironolactone with an ACE inhibitor because ACE inhibitors also cause potassium retention, which can lead to hyperkalemia, and severe hyperkalemia can cause cardiac issues. So this is the correct answer? Because spironolactone shouldn't be given with any drug that causes hyperkalemia. Aspirin, however, has no effect on potassium levels. A nurse is teaching a client about foods to avoid while taking an ACE inhibitor. Which food choice requires intervention? To determine which food choice requires intervention, we need to identify which of these foods contains high levels of potassium. White rice doesn't contain much potassium. Grilled chicken doesn't contain too much potassium. A banana smoothie, yes, that contains bananas, and bananas are very rich in potassium. So we shouldn't give a banana smoothie to this patient. Toast with jam. This isn't particularly rich in potassium, so I'll write out a list that you should keep in mind because sometimes on the exam, a specific food is mentioned, and you have to choose the right answer. So let's list some potassium-rich foods. Banana and, avocado. Potato, tomato, those classic everyday vegetables. Potato, tomato. Spinach. Coconut water and also salt substitutes are often chosen by people looking for alternatives to regular table salt. Salt substitutes do not contain sodium, but instead they're usually high in potassium. This means that while they can help those who need to reduce their sodium intake, it's important to keep in mind the higher potassium content when selecting these products. So these are foods to avoid for patients at risk of hyperkalemia. A client taking Enalapril reports feeling dizzy when standing up. This means the patient experiences dizziness upon standing. Which nursing instruction would be most appropriate here? We need to identify the correct instruction. Standing up quickly to improve circulation. Quickly? No, they shouldn't stand quickly since they're already dizzy. If the patient stands up too fast, the dizziness will worsen and they might fall. So that's incorrect. Rise slowly and sit if dizziness occurs. Yes, the patient needs to get up slowly. If the patient is lying down, they should sit up slowly before standing. And if they're already sitting, they should stand up gradually. Not quickly. So this is the correct answer. And if you want to check for dizziness, or if you want to see if there's any sign of orthostatic hypostatic present in the patient, you can do so by carefully observing their symptoms and monitoring their blood pressure as they change positions, just to be thorough. Then, a nurse should check the patient's blood pressure while they're lying down, then check it while they're sitting up, and finally, check it while they're standing up. If there's a significant drop in blood pressure from lying down to standing, then we can say that the patient likely has orthostatic hypotension. Increased caffeine intake? No. Caffeine intake won't help with the dizziness. And stop taking the medication immediately? A patient shouldn't stop their medication immediately without a prescription or a doctor's advice. Which laboratory value would concern the nurse most in a client receiving Captopril? If the patient is taking Captopril, Captopril is an ACE inhibitor because it has the suffix pril at the end of its name. So if the patient is taking an ACE inhibitor, like Captopril, then which laboratory value is of most concern? By concern, it means we have to find the abnormal laboratory value. Creatinine, 2.3 milligrams per deciliter. The normal creatinine level is 0.6 to 1.3 milligrams per deciliter. That means this value is way too high. So this would be the abnormal lab value, making it the correct answer. Sodium, 140 milliequivalents per liter. The normal sodium level is 130 to 140 milliequivalents per liter. This means it's within the normal range, so this is an incorrect answer. Calcium, 9.4 milligrams per deciliter. The normal calcium level is 8.5 to 10.5 milligrams per deciliter. So this is in the normal range. Glucose, 95 milligrams per deciliter. The normal glucose level is 70 to 100 milligrams per deciliter, so this is also normal. So those are the questions related to ACE inhibitors. We'll meet again tomorrow with a new topic. Thank you.